They are your local experts in orthopedics and sports medicine and rheumatology.
Today with OSMS, we hear about non-operative solutions to pain, whether that's from osteoarthritis or an injury.
One of those options is image-guided injections. With precise placement of the medication, patients can find many benefits to improve their pain.
Good morning, we're happy to be here today. I'm Lauren from OSMS, and today I'm joined by Dr. Michael Harper. He is our interventional sports medicine physician. Dr. Harper, thank you for being here today.
Thank you for having me.
Yeah, so interventional sports medicine, you're our first doctor that's interventional sports medicine. Can you tell us what it is that interventional sports medicine physician does and why you became one?
Yeah. So I primarily specialize in non-operative musculoskeletal and sports medicine care, treating things like osteoarthritis, knee, shoulder, and hip, also muscle injuries, tendon injuries, ligament injuries like an ankle sprain. But the interventional part of my title also emphasizes the advanced training that I have in both ultrasound and fluoroscopic guided injections. What led me down the path of wanting to become a sports medicine physician is, unfortunately, when I was in high school, I was a three-sport athlete, football, wrestling, and track, and every season of every sport I had some sort of injury, and I spent a lot of time with my high school athletic trainer, John. And throughout my time with him, ended up having a lot of knowledge gained about the rehab process and about different types of injuries, and really sparked the passion for getting players back onto the field, and ended up helping a lot of my high school teammates if they're in their rehab while I was dealing with a broken leg. So that sparked me to become an athletic trainer. Actually, I got my undergraduate degree at the University of Wisconsin La Crosse, and then after that decided I wanted to further my education, went to medical school. I was there for in Milwaukee for both residency and my medical school, and then I had a sports medicine fellowship in Manhattan at HSS.
What can patients expect from you as their physician then?
Yeah, so I want to empower them and giving them options to be an active participant within their care and giving them options of like, well, how do we treat this non-operatively? And so there's different things like therapeutic exercises, medication optimization, working then with the physical therapist or occupational therapist, getting them in touch with other types of practitioners such as chiropractic care or massage therapy as well, different bracing, and then ultimately also one of the things I'm specialized in is those interventions, those ultrasound guided injections.
Mm-hmm. So you mentioned that you really like educating your patients. That's amazing. I always appreciate that. So then what are some of those injuries and conditions specifically that you see that you would help educate your patients with?
Absolutely. So I see hip pain, shoulder pain, knee pain, kind of all the extremities from the head on down. And we specialize in things like osteoarthritis, muscle injuries, tendon injuries, and then also different types of sprains of ligaments. And so like an ankle sprain or hip osteoarthritis or tendonitis of the shoulder or elbow.
You do ultrasound guided injections, image guided injections. Could you explain to our audience what that is, just so that they have an idea of why they may get that? The
primary goal of an injection is to be able to help improve somebody's pain, improve their function, and ultimately improve their quality of life. What I utilize is both the ultrasound and then a fluoroscope, also kind of like an x-ray, to help guide the needle down to get precise placement and to put the medication right where it needs to be. There's multiple different advantages for doing a different type of ultrasound or fluoroscopic guided injection. Some increases the efficacy of the injection. Some of it might end up being that it helps diagnostically, figuring out where exactly the pain is coming from by precisely putting local anesthetic into a joint or around a tendon. I've also seen that it helps patients improve their comfort during a procedure by having it image guided as well.
How and where can someone make an appointment with you?
Yeah, so currently I'm seeing new patients at our OSMS location in Green Bay. There's 3 different ways that patients normally see me. One is scheduling a new office visit. You can do that by calling or making an appointment online. Additionally, you also can come see me by walking in and doing our acute injury clinic. So Monday through Friday, we have an acute injury clinic that's open from 8 until 5 p.m. And so if somebody has an acute injury like an ankle sprain, I might be one of the physicians that you might see when you come to our front desk and check in. And then also, because I perform those image-guided injections, one of our other providers might recommend those types of injections, whether it be one of our orthopedic or rheumatology providers, and they will have you scheduled with me to do that procedure.
OSMS has locations in Green Bay, Marinette, Neenah, and Oshkosh.
To make an appointment, call 920-430-8113. You can also do that online and learn more at osmsgb.com. That acute injury clinic is Monday to Friday from 8 to 5.